Alrighty, well, right now we're going to talk about something that is it's a crisis in our country, and it may be a crisis in the world, and it is the opioid crisis. And along with us right now is Dr. Prager, and alongside him is Andrea Sherman. And you are going to talk about addressing the crisis with non-opioids. Am I correct?
That's right.
Okay, what is a non-opioid? It's a painkiller that doesn't have opioids in it.
Well, it's actually not even a medication there, Susie. What we're talking about is electricity replacing medications. So you eliminate the potential for addiction to opioids, but if you're not taking opioids, you also eliminate the drug fog. If you don't have good pain relief or you can't stand being in a fog, electricity sends minute amounts of electricity through a pacemaker-like device to the central nervous system that blocks out the pain signal, so that instead of having the signal go up to the brain, it stops at the spinal cord.
Oh my goodness!
Not only does the patient not feel the pain, but they no longer suffer. And the suffering affects the family, it affects the ability to work, and affects how you feel. And so by making the pain go away and not having you in a fog, we have something very different than taking medications.
Oh my goodness, that is amazing. I mean, absolutely amazing. And Dr. Prager, you are the director of the Center for Rehabilitation of Pain Syndromes at UCLA Medical Plaza. I mean, did you all invent that at UCLA Medical Plaza?
I wish I did. I was what's called an early adopter.
Wow.
25 years ago, I started using it, and I'll tell you, it's like a miracle when it works. It's just unbelievable. We do a trial first, which is minimally invasive, just a needle with a wire, and if the patient likes it, they go on to have a pacemaker implanted in their body. And basically what I often see is the phoenix rising from the ashes. People who've been couch potatoes, popping medications, sitting on a couch, not having a life, not having the ability to get on the floor and play with their children, not having the ability to take care of their children, not being the spouse that their wife or husband married, and now all of a sudden they are the same person they used to be.
Unbelievable. Now, Andrea, okay, you were in an accident and you had surgery after surgery. And you went through all these opioids, and did you get addicted to them?
No, I wouldn't say I got addicted to them, but I did take them, and then I had 2 little children to take care of, so I didn't do that, but I did take them for quite a while, and I had surgery and procedure and therapy, but I couldn't function. I was totally disabled. I had no use of my one hand, and I was a mess. And like Dr. Prager said, I was a shell of myself. And when I finally met him and I trialed this spinal cord stimulator, I called him the next morning and said, this is the first decent night's sleep I'd had in 6 years. And I said, how soon can I get the real device? I went from having like this incredible stabbing, sharp, burning pain to having something that was totally different. And so I got the device, and it's been almost 20 years since I've had this device.
Oh my goodness.
I was able to raise my kids on my own. I was able to build a business, and now I feel like a totally different person, and all thanks to him. He's my savior, and this device has been my savior.
For 20 years you've had this device. How long has this device been around?
Well, this device has been around actually for 30 years, and the main thing that has kept it from being used more is ignorance. I mean, I didn't learn about it in medical school. Most doctors never learned about it in medical school. We don't learn about it in our postgraduate training. So shows like this
Yeah.
give the patients the opportunity to know, and there's a website called Ask About Pain that goes into it in much greater detail.
Ask
And not
About-
only on that website can you find out about the device. I mean, this is a device that's minimally invasive, it's non-destructive, it's fully reversible. If your pain goes away, you take it out. Now, if you have back surgery and it didn't work, you're stuck, okay? You had your back surgery and you can't reverse it. With this, if your pain goes away, we take it out. You're the same way as you were before with the little scar where the device was.
I thought
this is really an incredible technology.
I thought once you did this, that the piece of machinery was in your body forever. But once it does its job and stops the pain, you're done. It comes out.
No, that's not really true. In most
Oh.
patients, they still keep it. But there are some patients that whatever caused the pain goes away, and then you can take it out. And you use the word machinery. It just kind of bothers me a little
Okay.
bit because machinery sounds like something really big. And this is a small thing, a little bit bigger than a Susan B. Anthony that goes under your skin to control it, and a wire that comes out of it.
Unbelievable. Okay, unbelievable. The quality of life that someone can receive. Unbelievable. Well, I thank you so much. I mean, I'm just here, and everybody there knows that I'm usually not lost for words, but this has really, really impressed me. And Andrew, we're so glad that you're okay for 20 years with this device, this medical miracle. Is that better, Dr. Prager?
That's exactly what it is.
It's a medical miracle, and you really can find more about it at askaboutpain.com. That's provided for your viewers to be able to find a experienced, board-certified clinician who's qualified to provide this miraculous therapy, as you're calling it, a miraculous therapy to patients. Askaboutpain.com. You'll find out as much as you want to know.
And does insurance cover it?
Insurance can cover it. Most insurance does. There are some that don't, but most do.
All right. Well, thank you for being with us.
It's really been our honor and pleasure.
Wow.
Thanks,
Wow.
Susie.
You're welcome.